Hi everyone, Dr. Samina here, naturopathic doctor, and today I'm talking about the top 3 labs for PCOS and heart health. We know that women with PCOS are at a greater risk for developing heart disease, so it's really important to get assessed yearly in terms of your lab work to look at your risk for cardiovascular disease. Additionally, if you have a family history of cardiovascular disease, it's really also important to be getting these labs done as well. So today I'm going over 3 labs that I think are really important to get tested for on a yearly basis. The first one is the cholesterol panel. So this gives us a look at your long-term cardiovascular risk assessment. There are a few things that I'm looking for in the lipid panel. The first thing is triglycerides. These are a type of fat that accumulate in the liver, and sometimes we do see higher levels of triglycerides when there's insulin resistance present. So working on the insulin resistance can actually help with lowering the triglyceride levels. Second thing I'm looking at is HDL. This is good cholesterol. We want to see good numbers of good cholesterol. And then also your LDL, low density lipoprotein. This is bad cholesterol. And we see that when higher levels of LDL are present, LDL can actually readily stick to the artery wall and can cause plaque formation. This plaque formation is known as arteriosclerosis. And it's especially bad because it can actually restrict blood flow in our arteries. Some ways to reduce higher levels of cholesterol include a diet that is focused on the Mediterranean diet. So this diet is really rich in good healthy oils such as olive oil, nuts, very good amount of vegetables and fruits, and fish. The second way is through exercise, so moving your body, especially aerobic exercise, as it can increase our good cholesterol, HDL, and help us to lose weight, which eventually will lead to lower levels of LDL. So that's your cholesterol panel. The second thing is HbA1c. This is a screen for diabetes. It can actually tell you your risk for diabetes, if you're pre-diabetic or if you're at the risk or if you're at the level of diabetes, and will help us give a diagnosis as well. HbA1c is essentially our glucose that is bound to hemoglobin. Hemoglobin is a protein in red blood cells that will carry oxygen to various parts of the body. So HbA1c actually tells us the direct amount of glucose in the blood. And we know that red blood cells actually live for approximately 4 months. So this marker, HbA1c, gives us a long-term view of glucose in the body. Other tests we can consider alongside HbA1c is our fasting glucose, fasting insulin, and the insulin glucose challenge test. Last but not least, the third most important test for heart health and PCOS is Hscrp. This is a marker of a global inflammation in the body. It helps us to determine the patient's risk for heart disease and stroke. And we actually see that if the levels are greater than 3 milligrams per liter, it actually increases the risk for heart attack and stroke in patients who are actually healthy. So really important to be checking this one in PCOS as well. So inflammation can be present in a short period of time, so acutely, or chronic inflammation. Acute inflammation is when you get injured, for example, or you're sick from a cold or flu. Chronic inflammation is this steady inflammation that isn't really caused by a single event. We actually find that insulin resistance can actually be one of the causes of high Hscrp. Therefore, balancing blood sugar and insulin can really help to reduce Hscrp levels. The ways we balance blood sugar and insulin are through diet, supplementation, and exercise. Hope this was helpful in giving you some tips on heart health. If you have any questions, please pop them in the comments below, and I'll see you in the next video.